Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Barbara Sparacino. She is an adult and geriatric psychiatry and addiction medicine specialist and founder of the Aging Parent Coach. Today's Kevin MD article is Why Caring for a Parent is Hard for Doctors. Barbara, welcome to the show.
Thank you so much for having me, Kevin. I really appreciate it.
All right. So before talking about your article, just briefly share your story and journey, and then we'll jump right into your Kevin MD piece.
Okay, thank you. So I'm a psychiatrist and I went into psychiatry knowing I was going to do geriatrics because I've always been interested in older adults. And when I was in medical school, I was the Jerry whisperer. I would somehow calm down folks who were delirious. And so, but then, career takes over and I started doing more adult work than geriatric work. But with the pandemic, I saw that there was a need, right? Because there's a dearth, unfortunately, of geriatric psychiatrists. And I felt it was kind of a lapse on my part to not really be practicing geriatric psychiatry during that time. And so I started a micro practice and I started seeing that, for some reason, psychiatrists, and I don't know if physicians in general, but are really trepidatious about older folks, right?
Mm.
Like there were psychiatrists who refused to see patients over the age of 65. And as a geriatric psychiatrist, I have to tell you that no one is old until they're over 80, right? Like that's, so I was finding it a little crazy. And so I started, seeing patients and I started seeing how challenging it was for families to really adapt to now being caregivers, to now being responsible. And there was this trend I was hearing about parenting your parents, which I found a little bit off-putting and abrasive, right? Because we will never parent our parents, right? It's just the power differential never changes, right? I mean, I don't know anyone who goes home and is with their parents and remains a fully functional adult. Somehow we always regress even a little bit. And so I started really delving more into geriatrics, into helping adult children. And that's how I kind of veered off into the coaching part of helping families navigate this, right? And that is really where the focus of my career has been recently, is trying to help families navigate this because, we have such a high number of caregivers, right? That it is and most of the care is being done at home,
Mm-hmm.
right? And so, 29% of the population of caregivers is just like me, the sandwich generation, which is
Yeah.
in between high need parents and then high need children, right? And high need children that aren't necessarily underage either, right? Because we have some generational issues going on there too. So that's how I've come to this to be in this place in my career. I'm about 15 years out of residency, been, I guess, mid-career at this point, right? Which makes me sound a little old, but really finding new ways to contribute in as a psychiatrist, as a physician, and then also find it kind of leaking into my personal life.
Sure, sure. So
Right.
your Kevin MD article, very relevant for a lot of parents. Like you said, the sandwich generation have to take care of our own kids as well as our aging parents. Your Kevin MD article, Why Caring for a Parent is Hard for Doctors. For those who didn't get a chance to read your article, tell us briefly what it's about.
So it's really born out of what's really happening to me, right? And it's about how there is a saying in Spanish that we can't be a prophet in our own land, right?
Mm-hmm.
That we are never respected as the wise one in our own family, right? And so, and I think this is very, very true, especially for physicians, that for the most part, of course, I think people come to us when they need help. We are the free advice, the free medical advice, the free prescription, blah, blah, blah. But in moments of contradiction, or sometimes we lose the authority in our
Mm-hmm.
family because we are just the family member, right? And I think this is especially true with our parents, right? It is very challenging for them to see us as an authority figure. And we ought not be either, right? Because we lose a lot of this is why we're taught in medical school that we shouldn't really
Mm-hmm.
treat family, right? We should have some distance because we need the clinical perspective, the distance for clinical perspective. And that's what I was talking about how, we have so much knowledge, we have so much information, we help so many people. And sometimes when it comes down to it, and it comes to helping the people we love the most, we somehow find ourselves incapable,
Mm-hmm.
not able. It it can be very bewildering, and it can be very kind of disorienting, right? And so that's really what I was speaking to, that I don't have the same authority, right? Like my mom was recently hospitalized after a fall, which resulted in a fractured knee, which then resulted in surgery, and then that went on to her
Mm-hmm.
having some cardiac issues, and then that went on to her having takosubos,
Right.
being in the ICU. And and it was difficult for me to navigate that. And it just reinforced why I do what I do on, in my career, because I was like, if this is hard for me,
Yeah. Yeah.
if this is hard for me to navigate all this, how do people who don't have the savviness or the expertise of the medical landscape, how do they do it? Right? Because it can be crazy making. And it's kind of trying to straddle both worlds of being a physician, right, having the knowledge, and still just being a caregiver, a care supporter, and and being a good advocate for our
Yeah.
parents.
Yeah.
And so
So,
that was the tenor of the article.
so as a physician, what are some specific issues that being a physician within a family that you have versus other non-physician caregivers?
I mean, I think is the amount of knowledge, right? There is the there so we know that children of pediatricians, children of
Mm-hmm.
ER docs, right? My own child, we tend to undervalue, like underestimate or overestimate things,
Mm-hmm.
right? Very rarely are we kind of like right on the spot, right? And so we may minimize things that other people might take more seriously, right? So that we have a bias in that sense, because we often see things that are a lot more serious, right? And then we just may minimize this, right? I see this frequently in children of physicians who come in with cognitive issues,
Yeah. Yeah.
right? That, because everybody tells me with cognitive issues that, oh, it's been about a couple of months. And when I get into the nitty gritty of it, it's usually 3 to 5 years, right? That the deficits have started showing, right? And most true with physicians, and even myself, by the time I gave my grandfather a MOCA, the Montreal Cognitive Assessment, which has been famous recently, he had scored moderate dementia, and he was still living independently, and we had no idea. And I was already a geriatric psychiatrist at that
Mm-hmm.
point.
Mm-hmm.
So I acknowledge that even myself, right, there is this lens of seeing me be competent where it may not be present, right? Also, I think it's the being emotion, the emotionality is different, right? And learning
Right.
how to deal with the sense of vulnerability and helplessness, right? Because we are usually team leaders, we are usually the ones who are at the forefront of decision making, right? We are the ones who are kind of leading care, right? But when you find yourself in the not only the passenger seat but the back
Yeah.
the back seat, right? Kind of having someone else dictate care, however appropriate it is, can be disorienting, right? Especially when, and I think it also depends on medical specialty. I will say the bias of us, like, when trying to, for lack of a better word, insert myself
Mm-hmm.
or assert some authority. I wonder if as a psychiatrist, I have the same respect for my colleagues on the other end, right? And so it can be challenging, right, on that end as well, because you don't want to rock the boat. You don't
Yeah.
want to, you don't want the team to think that you don't trust them, right? So there's that, right?
So how do you balance that? How do you thread that needle? Like you said, you are sometimes wondering whether the colleagues who's caring for your parent, how they see you, but you do want to sometimes ask questions and sometimes assert yourself. So how do you balance that tension?
I mean, I think one of the best ways is to be rather transparent and candid, right? And of course, there are physicians who are more accessible, more approachable than others, right? But being candid and saying, look, this is my parent. I'm a physician. I understand that my role here is not a physician.
Hmm.
So I know enough to get me in trouble, right? And I don't, but I want to be a source of information for you and clarity for you. And I want you to be able to speak effectively with me, right? And I was able, when during this hospitalization, was able to do that rather effectively with most of the physicians, right? and clinicians, right? Because at this, it's not just physicians I'm speaking with nurse practitioners and
Yeah.
PAs and all the other healthcare workers. And so I think being transparent in that, identifying for the physician or the care team that I know my role.
Yeah.
I recognize my role, and I may offer like insight from my perspective, especially from my mom was delirious at one point, so of course I jumped in with that. But being transparent, because I think effective communication and having vulnerability, and also a little bit of the death of the ego in that
Hmm.
sense of not being, I think one of the great things about most physicians is that we know what we don't know,
Yep.
right? We kind of know when to be like, this is out of my wheelhouse, and being transparent, but also being a good facilitator and communicator to be able to translate things for my parents sometimes, right? Because at the end of the day, I want to facilitate communication, and I want to facilitate adherence to things, and just make sure that we get the best care without kind of stepping on toes and being abrasive, right? Or
Sure.
being kind of, yeah, overbearing, because that's not, because I know we've all worked with families like that, right? That think they're being helpful, and all they do is kind of make you have to take a deep breath before you come in the room,
Yeah.
right?
So in your article, you also talk about the dynamics between you and your siblings, you being a physician, and that sometimes changes and it makes awkward the dynamics you have with siblings. So talk more about that dynamics for those physician caregivers in relation to some of the siblings.
Yeah. So I am an only child of biologically, but I have so many step siblings. So I have a very, I have a very florid family in that sense. And so luckily in my family, I've been able to default be the point person, mostly because of age and eldest daughter, and because of practice, right? Because of but I do see that a lot of times, again, it's communications and inadequate or unrealistic or or the worst of all, unvoiced expectations,
Hmm.
right? People do not know what their roles are. People do not know who point persons are. One of the things when, as a physician, I'm treating someone, I always tell them, look, pick one point person. I
Yeah.
am not going to talk to everybody because I can't play telephone, right? Beyond having too many patients, it's also like telephone, right? So you pick one point person. But many families don't know how to do that, right? Or don't do that preemptively. And so there's not one person in charge of communicating with the physician, right? And so we have piecemeal information, which can be very disruptive
Hmm.
and dysregulating to the family when they don't know good information, right? And I think one of the strengths of being the physician in the family is that you can be a good interpreter,
Yeah.
right? Because I mean, I had my friend the other day, her father was in the hospital, and she was telling me about his that what was it? Like that they diuresed him. I'm
Hmm.
like, did they use that word with you? Diurese? She's like, yeah, I had to look it up. I'm like, yeah, what? Like, anyway, I mean, and she's she's in advertising, nothing medical.
Hmm.
So I think that's the strength, right? But there has to be trust that you are going to be giving accurate and complete information, not holding things back, and not trying to assert yourself as a position of power, but just being really a facilitator. And I think it's important in families, really, like when there's siblings who are willing to show up, right? Because that's the other
Yeah.
problem. There's ones who show up and the ones who don't show up, right? And typically in these situations, when someone shows up, the loudest person is the person who kind of gets their way, right?
Yeah.
Which is not always effective or efficient. And so, but having different point persons and different responsibilities and saying, look, I'm the point person for healthcare, you're the point person for financial responsibilities or decisions, or, having assigned roles so people don't feel left out or feel helpless or discarded, right? Because many times it's just about wanting to be of service and help and have information and not just feel left out, right?
Sure.
And feel like, oh, you're taking over. Because there's always that other thing of like, oh, what do you think we're, not as smart as you because we're not understanding this? And it's not about that. It's about just navigating the language, right?
Hmm.
Understanding the way we talk sometimes that, from the vast majority of people, if you hear doctors talking about something, they get dizzy with the abbreviations, the acronyms, and you may not understand what's going on, right? Or you may think you do, right? Because there's a
Yeah.
lot of words that are used in medicine colloquially, that don't mean the same thing,
Hmm.
right? So yeah, so I think that's the best way is to have before these emergencies happen, right?
Sure.
And as I've been talking to my parents about healthcare proxy, about all these things, like for about 10 to 15 years now.
Yeah.
And had it all done, try to update it every couple of years to make sure we're on the same page. I ended up having to be a healthcare proxy for my mom when she was found incapacitated because of the delirium, so, and I was glad that it was very well articulated by her
Yeah.
that I was the proxy. So things were simpler, right? Even with my stepfather, things were simpler because everybody knew their role and nobody was feeling usurped. Nobody was feeling, I mean, at least not externally, right? Who knows? But I think it's better to have a plan in place so we're prepared, because we do know that when we can identify things that we can do, right, in ways we can help, even it's in the not doing, it's much more effective than feeling clueless and out of control and
Hmm.
helpless, right? Because at the end of the day, what we want to do is really protect our parent,
Yeah.
right? And also not drive ourselves crazy in the bargain, because I don't know anyone, and I'm sure you don't either, who has time to spare.
Yeah. So you are the aging parent coach. Obviously, you have that coaching practice specific to this topic. Now, for those other caregivers who may be listening to you, what would you say are one of the top tips that you can share with them to help ease some of these situations?
So I think the number one tip for caregivers is that you can't give from an empty cup, right? That many times caregivers, and look, and caregiving can encompass so many things. I think people often misconstrue caregiving as with the person actually providing the service,
Hmm.
as opposed to, like in everything else in life, there's different layers,
Yeah.
right? Because I have caregivers who live in another country and a parent lives here, right? And so caregivers can mean a lot of things. If you feel responsible, if you are making decisions or you are helping them make decisions, then you are a caregiver, right? It does not necessarily only mean the physical caregiving.
Hmm.
And I think that the best thing you can do is prioritize yourself, your mental health, because we do know that there is high rates, about, I think, one third, if not half, of caregivers suffer with symptoms consistent with depression, right? And with clinical depression. And it can be overwhelming, right? They have higher rates of stress, higher rates of burnout,
Hmm.
higher rates of, compassion fatigue, all these things. And again, it's not like people are doing this in a vacuum. They still have to maintain their lives,
Hmm.
maintain their other relationships, and still prioritize the things that they want to prioritize while also trying to help the folks that they love and want to provide caregiving to.
Sure.
And so I think being very mindful of boundaries, right? Being very mindful of what you are capable of giving, irrespective of somebody else's expectations of you, right? Is so much healthier than trying to constantly chase this idea or this notion of what a perfect child is, what a perfect caregiver is, and I think depending on cultural backgrounds, there's different expectations for how much you're going to be responsible for your aging parent, right? We have cultures where, your parent is expected to move in with you,
Hmm.
right? And you have cultures where your parent is expected to go to a nursing home, right? And all the way in the middle, and things are fluctuating, right? We don't have as many intergenerational homes as we used to, right? Where people would age in place because everyone aged in place.
Yeah. Yeah.
And so I really think really prioritizing your own self-care and having a good outlook or a good blueprint for what caregiving looks like for you and what you're willing or able to do will be very, very beneficial for being an effective, loving caregiver for your parent, right? Because I think, and because hopefully you will outlive your parent and you still
Yeah.
have a lot of living to do, right? Also, while remembering, because this is one of the other things I tell folks, is that as we navigate this transition with our parents, our children are watching how we navigate this,
Yeah.
right? And so what we are modeling how we potentially expect to be treated by our children, right?
Hmm.
So, not to add more pressure, but that's the truth of it, right?
Yeah.
So, yeah.
We're talking to Barbara Sparacino. She is a adult and geriatric psychiatrist, addiction medicine specialist, founder of the Aging Parent Coach. Today's Kevin MD article is Why Caring for a Parent is Hard for Doctors. Barbara, let's end with some brief take-home messages that you want to leave with the Kevin MD audience.
So, I want everybody to know that the vast majority of caregivers are under the age of 50, right? And so they are also in the sandwich generation, right? And, you know, when your parent, when it's your parent, you're not practicing medicine.
Yeah.
You're practicing love under pressure, right? You know, I want folks to realize that, I want fellow physicians to realize that while they are still a physician in this role, they are much more vulnerable and much more and emotionally, without their lab coat on, right? And that's okay. And I think showing that vulnerability, especially to your colleagues, will be helpful for everyone because we are all in this together. Because, all of us have had parents. Hopefully, folks' parents are still living and healthy, right? But we will all go through this at one point. And I think being supportive of one another and being compassionate, and also if you see a physician, a fellow physician struggling with this, maybe approaching it from this perspective of knowing that they're also navigating being not in control, right? Because, we have upwards of this year, I think it's upwards of 7 million patients living with Alzheimer's, right? And so in this country, and that is just the tipping point. Those are just the ones that have been diagnosed. And that's not even taking into account all the other medical comorbidities. So we have a long road ahead of us, right? And so, but the good thing is that we have ways of making sure that our parents' wishes are respected, their autonomy is maintained, and that our relationships are maintained with them. And I also want to remind folks that, again, let's not consider parenting our parent, right? Because they are always our parent.
Yeah.
And we just fall into this new role of trying to help them maintain that autonomy as they age. And because once they're gone, that's when our vertical authority is gone, right? And I think that's when people finally feel like adults, right? And so I hope to stay a non-adult for as long as possible.
Barbara, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much for having me. I appreciate it.